Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about hypertension. In particular, I will cover what hypertension is, how you treat it, and how you can better live with hypertension. So we start with, what is hypertension? High blood pressure, or hypertension, is usually defined as having a sustained blood pressure of 140 over 90 millimeters of mercury or above. So blood pressure is the pressure the blood exerts on the walls of the arteries as it passes through. High blood pressure often causes no symptoms or immediate problems, but it is a major risk factor for developing a serious cardiovascular disease. So there are conditions that can affect the circulation of blood around the body, such as stroke or heart disease. If you have high blood pressure, your heart has to work harder to pump blood around your body. Over time, this can weaken it. Also, the increased pressure can damage the walls of your arteries, which can result in a blockage or cause the artery to split or hemorrhage. Both of these situations, again, can cause a stroke. And in Ireland, it is estimated that 60% of adults over 44 have some degree of hypertension. So the symptoms: high blood pressure does not normally cause any symptoms until it has reached a very high level, typically 180 over 110 millimeters of mercury. Symptoms that your blood pressure has reached a very high level include a headache that lasts for several days, nausea, dizziness, drowsiness, blurred or double vision, nosebleeds, irregular heartbeat, which are palpitations, shortness of breath as well. So if you experience any of these symptoms, you should go to see your doctor immediately. There are two types of high blood pressure. There's primary or essential blood pressure or hypertension. In 90 to 95% of high blood pressure cases in adults, there's no identifiable cause. And secondary hypertension, the other 5 or 10% of blood pressure, are caused by an underlying condition. This type of blood pressure tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, including kidney abnormalities, tumours of the adrenal gland, certain congenital heart defects, certain medications such as birth control pills and cold remedies, decongestants, the over-the-counter pain relievers, and some prescription drugs, illegal drugs such as cocaine. And next, high blood pressure risk factors include age. So the risk of high blood pressure increases as you age. Next would be your race or ethnic background. High blood pressure is particularly common among black people, often developing at an earlier age than it does in whites. Next is family history. A high blood pressure tends to run in families. Also, being overweight or obese and not being physically active and using tobacco, and too much salt in your diet, too little potassium in your diet, and too little vitamin D in the diet, and drinking too much alcohol and being under too much stress. So next is, how do you treat hypertension? The major types of medication used to control high blood pressure include thiazide diuretics. So diuretics are medications that act on your kidneys to help your body eliminate sodium and water, reducing blood volume. So for example, Central or benzoyl is one. Next drug is beta blockers. These medications reduce the workload on your heart and open up your blood vessels, causing your heart to beat slower and with less force. And these would be Atacor, Mcor, Cardicor. Next is the angiotensin converting enzyme, or ACE inhibitors. These medications help relax blood vessels by blocking the formation of a natural chemical that narrows blood vessels. Example of these would be tritase. And next is angiotensin II receptor blockers. These medications help relax blood vessels by blocking the action of a natural chemical that narrows blood vessels. And this, for example, would be Omesar and Diovan. Calcium channel blockers. These medications help relax the muscles of your blood vessels, and some slow your heart rate. So Istin is an example of these. And renin inhibitors. So Rasilis slows down the production of renin, a chemical produced by your kidneys that starts a cascade of chemical steps that increases blood pressure. So if you're having trouble reaching your blood pressure goal with combinations of the above, your doctor may prescribe alpha blockers. These medications reduce nerve impulses to blood vessels such as cardura, or central acting agents, and these medicines prevent your brain from signaling your nervous system to increase your heart rate. A Dixerit would be an example. Also, there's vasodilators. These medicines work directly on the muscles in the walls of your arteries, preventing the muscles from tightening and your arteries from narrowing. So an example is apresilene. So finally, how do you live with hypertension? High blood pressure isn't a problem that you can treat and then ignore. It's a condition you need to manage for the rest of your life to keep your blood pressure under control. Take your medications properly. If the side effects or cause problems, don't stop taking the medicine. Schedule regular doctor visits. So work with your doctor to bring your blood pressure to a safe level and keep it there. Adopt healthy habits. So eat healthy foods, lose excess weight and get regular physical exercise. Limit alcohol. And if you smoke, you need to stop. And manage stress. Say no to extra tasks. Release negative thoughts, maintain good relationships, and remain patient and optimistic. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing hypertension more effectively on a day-to-day basis. To start with, we have numerous products to get you started on a gentle exercise program, such as exercise balls, floor mats, weights, and various other items you need to get started on a program. And we will create it together, and the program will be tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as psyllium husk, coenzyme Q10, flaxseed, the omega-3 fish oils, cod liver oil, calcium, magnesium and garlic. We also have light boxes to promote relaxation and blood pressure monitors, blood sugar monitors, body fat monitors and assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering at Telehealth Clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together, we create a cohesive management plan which enables you to take a more active role in managing hypertension with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.